Welcome back. My name is Robert. I'm a registered nurse, and this is a continuation of what to place on the envelope that's going to hold your loved one's medical history papers, things you'd want paramedics and fire rescue to see instantly. To recap, prior to the break, where standards were reviewed that could be used by anyone, this next part will entail those specific aspects which may be related to your particular loved one. Before starting though, if the new information to be discussed leads to have little to no room on the front of the medical history envelope, right at the very bottom in large enough letters to be seen, continued on back of envelope with an arrow pointing towards the right. That way, if paramedics or fire rescue see this written, they'll know to turn it over to find any additional information. If your loved one does not speak English, down the left-hand corner of the envelope, write the word language followed by a colon. To indicate this, a choice can be written is Spanish speaking only, or the word Spanish and in parentheses next to it, speaks some English. If Spanish is incorrect, write the name of the language as applicable, because most hospitals do have access to a video computer screen that can be used to converse live with an interpreter in any language. If relevant, underneath write education followed by a colon. This part would apply to those that are unable to read or write English. Where there is assumption that someone from another country may not be able to, we cannot rule out someone from this country being illiterate. To specify, write cannot read or write English. In addition, what can be written, if indicated, is if your loved one does not possess a form of higher education. An example to write could be 6th grade education. If either one of these is the case, this could lead to a medical staff member who would go over with your loved one what's written on the hospital procedure and consent forms to be signed, and if needed, simplify information to their level of understanding. Moving forward, subsequent parts to be mentioned will start at the top of the head and proceed down the body. Then down the left side of the envelope, write the word mind followed by a colon. If applied, words that can be written are Alzheimer's disease, dementia. If you know what form of dementia, such as Lewy body dementia, which is what comedic actor Robin Williams had, write that. If your loved one is bipolar, schizophrenic, autistic, or has an intellectual disability, indicate that as well. By doing so, this could very much help the doctors and medical staff in the emergency department on how to approach and speak with your loved one. As an added note, if your loved one has a history of seizure activity, specify what type of seizure and last known occurrence. Going down the left side of the envelope, write eyes followed by a colon. Words you could write are poor vision, wears reading glasses, wears bifocals. If they're blind in one eye, what could be written is blind in left eye, approach on right. Any specific medical conditions related to loved one's eyes will be listed on their medical history paper inside the envelope. Written below this is ears followed by a colon. Words you could write are hard of hearing, wears hearing aids, left, right, or bilateral. If deaf in one ear, write, for example, deaf in left ear, speak into right. If your loved one wears oxygen, you would write nose followed by a colon. Oxygen settings via nasal cannula, which can either be continuous or as needed, are usually at a 2 to 4 liter range. So you'd want to specify, for example, oxygen worn via nasal cannula at 2 liters continuous. If they wear a CPAP, a continuous positive airway pressure, or a BiPAP, bilevel positive airway pressure at night related to sleep apnea, you'd want to indicate and write sleep apnea, the full name of the device or its abbreviated form, followed by the words worn at night. If your loved one uses a rescue inhaler, write uses, then the name of the medication, for example, albuterol, followed with the words rescue inhaler. Write the word mouth followed by a colon. Words you could write are dentures, uppers, lowers, or both. If your loved one perhaps has garbled speech, you would want to indicate this, and this is the reason why. There is a test doctors perform in the emergency department if a stroke is suspected. It's called the National Institute of Health Stroke Scale, and its abbreviated form is NIHSS. So if the emergency department doctors can determine by the front of the medical history envelope that your loved one's garbled speech already exists, it's one part of the test they could possibly rule out. State a prescribed diet if ordered, and if the texture of your loved one's food is specialized, such as mechanical soft, pureed, honey thick, nectar thick. For including this may lead to a speech therapist and or dietitian seeing your loved one while in the hospital, who can then tailor their meals in the same fashion. If your loved one has a tracheostomy, write throat followed by a colon. Next to the word tracheostomy, write the date it was surgically inserted. Examples, since May 2023. Very important. The instructions inside the envelope should include the name of the doctor handling the tracheostomy, their address and phone number, a nurse that may be involved, and their direct phone number. This should also indicate how your loved one's tracheostomy tube care and cleaning are done and equipment used. For chest, followed by a colon, start with the word pacemaker if your loved one has one. A pacemaker, which is usually located in the left upper chest, can be single or dual chamber and set as continuous or on demand. An example to write can be pacemaker, left upper chest, dual chamber, on demand. If your loved one has instead an AICD, automatic implantable cardioverter defibrillator that's able to shock a life-threatening arrhythmia if one should occur, write that. Either way, in both cases, write next to it the word since, and then the date it was first surgically inserted. Underneath in parentheses, write C, pacemaker or AICD instructions inside the envelope. If your loved one has a pacemaker or AICD, their cardiologist should have given them a card to carry with them at all times that show their settings and placement. What I would recommend is to take it to a store that has the ability to take a colorized picture of both the front and back of the card and place the pictures on one side of a sheet of paper. And underneath that, if not listed on the card, the name of the doctor in charge of the pacemaker or AICD, their address and phone number, and any additional person or manufacturer's phone number involved as well, such as Medtronic or Merck, and place this in your loved one's medical history envelope. Please review with your loved one's primary or cardiologist for further information. A portacath or central venous catheters, CVC, are devices that can be found in either the left or right upper chest area. In comparison, a portacath is one mainly used to receive chemotherapy-related cancer medication, whereas central venous catheter can be used for dialysis treatment. If you're to write either one, write next to it the word since and the date it was inserted. Place aside or underneath indicate if your loved one is still receiving chemotherapy and how often, or write the word last chemotherapy treatment in front of the end date if no longer on it. If your loved one has a central venous catheter used for dialysis, indicate what days they receive dialysis. Dialysis is usually a 3-day-a-week process of either Monday, Wednesday, or Friday, or Tuesday, Thursday, or Saturday. The place where your loved one goes to receive their chemotherapy and or dialysis will be listed on their medical history papers inside the envelope. We're going to take another short break, so please stay tuned.